While here at Tufts, you may experience or witness a medical emergency. Medical emergencies happen in a wide variety of situations and can range from minor issues such as tripping and falling while walking to class to major concerns such as finding a friend having difficulty breathing. In the event of a medical emergency, the first step you should take is to call the campus emergency number. From a cell phone, dial 617-627-6911. Or from a campus telephone, dial extension 66911. This number serves as the emergency number for the Tufts community. It is also located on the back of your student ID. If you do find someone unresponsive, there are public access defibrillators located around campus for use if you are trained. Tufts is a heart-safe campus, which means at least 5% of the student body knows CPR. If you do not know CPR or how to use an AED and would like to learn, go to the Tufts EMS website to learn how. But remember, it is important you always first call the emergency number. Your call will be answered by an emergency medical dispatcher at the Tufts Public Safety Communications Center. The dispatcher will ask you a series of questions and may provide you with instructions of what to do until help arrives. Stay calm and follow these directions, and stay on the phone until the dispatcher ends the call. While you are on the phone with the dispatcher, help is already on the way. Tufts Emergency Medical Services, also known as TEMS, and the Tufts University Police Department, or TUPD, will both respond to your location to provide emergency medical care. TEMS is our on-campus emergency medical service, and it operates a Massachusetts-licensed ambulance that is staffed 24/7 by certified emergency medical technicians, or EMTs. If you can do so without leaving the patient alone, send someone down to the door to make sure it is unlocked and to escort medical personnel to the location of the emergency. Once on scene, TEMS will provide medical assessment and treatment to anyone involved in the medical emergency. In some cases, TEMS will call for assistance from an outside ambulance company or fire department from the host community to help treat and transport those involved in the emergency. Once assessed, you may receive transport to a nearby hospital for further evaluation and treatment. Tufts community members are generally transported to the Lawrence Memorial Hospital or Somerville Community Hospital, which are both nearby the Tufts campus. Once you have been treated at the hospital, you may call the TUPD non-emergency number 617-627-3030 for a ride back to campus. Although we always recommend that in any medical emergency you receive transport to the hospital, in most cases you may refuse treatment or transport if you wish. Fear of going to the hospital and riding in an ambulance should never deter you from calling help. It is always better to call, receive treatment from our medical personnel, and refuse transport than not call at all. In fact, most of our medical insurance plans, including the Tufts Student Insurance Plan, do cover emergency ambulance transport and hospital treatment. Moreover, any services that Tufts EMS provides is free of charge, but it is also important to note that if you are under the age of 18, medical personnel may be required by law to contact your parents or guardians to notify them of the emergency and receive consent to treat. If you are sick or injured, but are not experiencing a medical emergency, there are other options. Students have the choice to visit Tufts Health Service at 124 Professors Row. After hours, you can also call Health Service to reach a nurse if you want to talk and ask a question or get advice about a condition. This number can be found on the Health Service website. In the event that Health Service is closed, or if you are unsure whether or not you are experiencing a medical emergency, you should call the Tufts emergency number 617-627-6911 to receive help. When in doubt, you should always call. When being evaluated and treated by medical personnel, remember to be cooperative and answer questions honestly. These questions are intended to assist you in medical care, not to get you in trouble. In fact, Tufts has a policy that can relinquish you from disciplinary action for your alcohol use when you are being treated in a medical emergency. This can extend to your alcohol use when calling Tufts EMS for a friend as well. Please see Tufts Medical Amnesty Policy for more details. Although medical emergencies come in all shapes and sizes, excessive alcohol use is a leading cause of death on college campuses and accounts for nearly 1,825 student deaths per year across the country, according to the National Institute on Alcohol Abuse and Alcoholism. You should never be afraid to call for help when you or your friend needs it, even if alcohol and drugs are involved. Remember, calling for help may save a life. Whether you are with a friend who is vomiting at a party, you fell and hurt your wrist walking to class, witnessed someone collapse, or are just feeling very sick in your dorm, don't be afraid to call the Tufts emergency number and receive the help you need. Tufts Emergency Medical Services and the Tufts University Police Department are here to help you stay safe, healthy, and make the most out of your time here on the Hill.